Good morning, class. My name is Alan Menendez. I will be talking to you about ethical issues in nursing. To begin this presentation, I have included a quote from Myrtle Adela, who is an American nurse, professor, and a hospital administrator. Nursing encompasses an art, a humanistic orientation, a feeling for value of the individual, and the intuitive sense of ethics and of the appropriateness of action taken. What is ethical? What is ethics in nursing? Ethics is defined as principles or standards that govern proper conduct. Ethics is the study of conduct and character. Acts that are ethical reflect a commitment to standards that individuals, professionals, and society strive to meet. It is concerned with determining what is good or valuable to individuals, groups, and societies at large. When decisions must be made about healthcare, understandable disagreements may occur among healthcare providers, families, patients, friends, and people in the community. The right thing to do can be hard to determine when ethics, values, and perceptions about healthcare collide. Personal ethics versus professional ethics. What is the difference between You might be wondering what personal ethics are. Personal ethics refers to ethics that a person identifies in respect to person and situation that they deal with every day in everyday life. Personal ethics is the code that governs an individual's whole life. They learn from childhood and influenced by family, religion, friends, and close surroundings. Examples include honesty, openness, integrity, sincerity, etc. Now I move on to professional ethics. Professional ethics refers to the ethics that a person must adhere in respect to their interactions and businesses dealings in their professional life. Professional ethics are imposed on employees or members of a certain profession. This form of ethics is learned relatively later in life, especially after joining the workforce. Examples include punctuality, time management, confidentiality, and transparency. Comparing and contrasting ethical theories. There are several ethical theories, but the ones that are mainly talked about are utilitarianism and deontological theories. Let's begin with utilitarianism. Utilitarianism is the decision making on what provides the greatest good for the greatest number of people. It is making the decision based on what will benefit the majority. Utilitarian ethical theories are based on one's ability to predict consequences of action. To a utilitarian, choices that yield the greatest benefit to the most people is the one that is ethically correct. There are two types of utilitarianism. There's act and rule. Act utilitarianism subscribes precisely to the definition of utilitarianism. A person performs the acts and that benefit the most people regardless of personal feelings or social constructs such as laws. Rule utilitarianism takes into account the law and is concerned with fairness. A rule utilitarian seeks to benefit the most people, but through the fairness and most just means available. Therefore, added benefits of rule utilitarian are that it values justice and includes benefits at the same time. Let's move on to deontological ethical theories. Deontological ethical theories are decisions making based on obligations, duties, and what one considers to be right or wrong. It is identifying one's duty and acting accordingly. The deontological class of ethical theory states that people should adhere to their obligations and duty when engaged in decision making when ethics are in play. This means that a person will follow his or her obligations to another individual or society because upholding one's duty is what is considered ethically correct. For instance, deontologist will always keep his promise to a friend and will follow the law. A person who adheres to deontological theory will produce very consistent decisions since they will be based on individuals' set duties. Here's an example of utilitarianism in the sense that you have, if you choose the right side, it kills one person. If you choose the left side, it kills 5 people. So utilitarian would obviously choose the one to the right. It'll kill somebody, but it will save the most majority of people. It benefits the most majority of people. Here is an example of deontology. Sometimes we have to act in a way we believe is ethically wrong because the outcome will be good. What are codes of ethics? A code of ethics is defined as a set of guiding principles that all members of a profession accept. It is a collective statement about the group's expectations and standards of behavior. The American Nurses Association, also known as ANA, review and revise the code periodically, but principles and responsibilities, accountability, advocacy, and confidentiality remain constant. Here are 4 constant principles that are uh, in, uh, in the Code of Ethics. Let's begin with advocacy. Advocacy refers to the support of a particular cause. As a nurse, you advocate for health, safety, and rights of patients, including their right to privacy and right to refuse treatment. Your special relationship with patients provide you with knowledge that is specific to your role as a nurse, and as such provides you to make a unique contribution to understanding a patient's point of view. Next, we move on to responsibility. Responsibility refers to a willingness to respect one's professional obligations and follow through. An example of this is following an agency's policy and procedures. As a nurse, you are responsible for your actions and the actions of those whom you delegate tasks to, like an AMP or LPN. You agree to take responsibility to remain competent to the practice so you can follow through on your responsibilities reliably. Moving on to accountability. Accountability refers to the ability to answer for one's actions. As a nurse, you ensure as a nurse as a nurse to ensure that your professional actions are explainable to your patients and employer. Healthcare institutions also exercise accountability by monitoring individual and institutional compliance with national standards established by agencies such as the Joint Commission. Joint Commission establishes national patient safety guidelines to ensure patient workplace safety through constant and effective nursing practices. The ANA promotes ethical decisions making by setting standards of collaborative practice through multiple disciplinary discourse. Finally, confidentiality refers to the rights and privileges of patients for protection of privacy. Federal legislation known as Health Insurance Portable Accountability Act of 1996, also known as HIPAA, mandates confidentiality and protects patients' personal health information. This legislation defines the rights and privileges of patients for protection of privacy. It establishes fines for violations. In practice, you cannot share information about a patient's medical condition or personal information to any that is not involved in the care of the patient. What are ethical dilemmas? Ethical dilemmas are defined as a situation in which a different choice difficult choice has to be made between two courses of action, either of which entails transgressing a moral principle. Ethical dilemmas cause distress for both patients and professional caregivers. To minimize the stress, participants strive to process ethical issues carefully and deliberately. Ethical dilemmas can be solved by modeling behavior so that people will watch how something is done right and can act the same way. An ethical dilemma can also occur when a person is not ready to disclose his or her decision or action in advance. An ethical dilemma occurs when a person doesn't know to rescue themselves in a case of conflict of interest. There are several ethical issues that are noted in healthcare today. Below, I provided three of the most seen, the most common ones. So discrimination, malpractice and negligence, and patient confidentiality. When a healthcare provider oversees patients' health, disagreements about treatment decisions, waiting lists, and access to resources can be some of the challenges that pose ethical dilemmas. Ethical decisions don't have the same consequences as unlawful practices. If a healthcare administrator faces the challenge of a busy emergency room, they are not lawfully required to promise people that the process will speed up, but can be ethically responsible for them to raise the concern with the Board of Administrators. Healthcare institutions may create ethical committees to facilitate reasonable decisions making and respect values and concerns of the patients, their families, and healthcare providers. Resolving an ethical dilemma is similar to the nursing process in its methodical approach to clinical issues. But it's different from the nursing process in that it requires a negotiation of differences of opinion and clarity of the situation that are confusing and not easy to solve. Finding clarity can occur when the following elements remain essential to the process: the presumption of goodwill on the part of all participants, strict adherence to confidentiality, patient-centered decision-making, and welcome participation of families and primary caregivers. The process begins by determining if an ethical dilemma exists. If the answer has relevance for several areas of human concern, then an ethical dilemma exists. You then gather information relevant to the case that includes review of medical records for recent clinical evaluation. Examining your personal values at this point can help differentiate between fact and opinion, an important part of this process. Once information is gathered, getting a conscious on a statement about dilemma will facilitate discussion. The next step is to list all possible courses of action to guide the discussion towards a possible solution. As a group, you consider and evaluate alternatives with respect for all differences of opinion. Most of the time, people in an ethical conflict come to a resolution and implement a plan. The final step is the evaluation of a plan. So I provided the steps to resolving ethical dilemma. So we can just go through that right quick. First, you ask the question, is this an ethical dilemma? Next, you gather information relevant to the case. Then you clarify values. You follow with verbalization of the problem, identifying possible courses of action, negotiation of a plan, and finally, evaluation of the plan over time. So now this section is a quiz time. I provided. So what I'm going to do here is I'm just going to read the question out loud. You guys can pause the video, answer the question amongst yourselves, and then I'll give you the answer right after that, okay? So, question 1. Which statement would best explain the role of the nurse when planning care for a culturally diverse population? The nurse will plan care to. The answer is D. Provide care while aware of one's own bias, focusing on the client's individual needs rather than the staff's practices. Question 2 is ethical principles for professional nursing practice in a clinical setting are guided by the principles of conduct that are written as the. The answer is A. American Nurses Association, ANA, Code of Ethics. Question 3 is a client who had a do not resuscitate order passed away. After verifying there is no pulse or respiration, the nurse should. The answer is C. Remove all tubes and equipment unless organ donation is to take place. Clean the body and position appropriately. Question 4. A healthcare issue often becomes an ethical dilemma because. This one's a little difficult. When I saw this, the reason why I picked this question is because it was a little difficult for me to answer. But the answer is D. The choices involved do not appear to be clearly right or wrong. Question 5. Nurses agree to be advocates for their patients. Practice of advocacy calls for the nurse to. The answer is C. Assess the client's point of view and prepare to articulate this point of view. That's what advocacy is about. Yes, sir. All right, so that is my presentation. Thank you very much. I hope that you guys answered these questions. You guys had fun answering these questions. Hope my presentation wasn't too boring. Here are my references. And that's that. Thank you very much.